Welcome to the playground, children. It's time for a game of Chuck, Chuck, Goose. Welcome back to MB2 Underground. My name is Sarah Kiefer. I've been laughing at that in my own head for like 20 minutes. It's not even funny.
No, that was great. That was great. And I'm Jonathan Tyrock, better known as JT.
How's it going?
It's great. I was, last night was a bit stressful for me, but this morning is a new day and I'm feeling awesome.
That's the spirit.
Yeah.
Are you ready for a chuckle good time?
You know, one of my kids' names is Charlie, and I should have more Chuck puns, but
Yeah.
I don't. So I'm glad that you're bringing
Just
them.
chuck them out the window.
Just keep on going, Sarah. Yes, but I am ready for a chucking good time, I guess.
Damn, that was a good one.
Was that a good
How
one?
did I miss that one?
I don't know. Today, our guest is the CEO of DDS Lab.
Bet you won't guess his name.
Maybe it's Chuck DiNardo. Chuck,
Welcome.
Welcome.
Thank you. I can't respond to that, right? I don't know what to say. I can't add. I'm not quick enough.
I was about
add
to say,
that little
what did we miss?
soliloquy. Nothing. Maybe woodchuck. You want to go with something like that?
Woodchuck. Come on our podcast?
There you go. Yep. That's real.
Chuck Wood.
There you go.
Oh, my gosh.
How's it going?
It's going well. How's it going with you? Well, thank you for inviting me to the podcast.
We
Look forward to
appreciate you
being
coming
here.
out.
Yeah, we're glad you're here. We're glad you're here. We know DDS Lab has done a great job and has a great relationship with MB2, and so we're excited to get to hear some of your backstory and how everything came about.
We certainly welcome the partnership we have with MB2. It's over a long period of time, and we generate a tremendous amount of value as a result of it. So thank you.
But you didn't start out in healthcare. You started off as an attorney.
I did. So if I told you my little backstory, I was born and raised in Pittsburgh, PA, so I'm a passionate
Go Steelers.
Steeler. Yes, we could talk about that separately. I love it.
I did my research.
You did? Okay. So then I went on to go be an accountant, right? So I went to an undergrad in
Wait, an accountant on purpose?
No, so I'll get to that. So
Said absolutely not.
yeah, only for an interim period of time, very
Okay.
short. So I was in accounting, and then I went on to become a corporate securities attorney for a period of 6 years. And then
I just got a question from our listeners. What's a corporate securities attorney?
that's somebody that merges publicly traded companies or private companies or public offering
Oh, wow.
of stocks.
Big boys.
Yeah, that space wasn't for me, though. So.
Did you, from your time as a corporate securities attorney, that's a mouthful to say.
It is.
Most fun, memorable deal that you were involved in that you can share? I guess some of them may be
If there's an NDA, don't break it.
undisclosed.
Yeah, so that was years ago for me. I think the most exciting thing about being a corporate securities attorney was actually leaving being a corporate securities attorney. So,
That's the spirit.
yeah, so I
Fair
did
enough.
it for a number of years. Really worked with really intelligent people, really met some strong leaders in that period of time. But for me, it was hard to find a purpose, right? So I had the opportunity at a certain point in time to move from being an attorney into healthcare, and I found that to be a fascinating space.
Why did you do it? Why did you step out of legaling?
Legaling?
Yeah.
Really because, as I indicated, I did it for 6 years, but from my perspective, it was hard to find a purpose. You're just doing transactions. I was more interested on the company side than I was on the transactional side.
So you're ready to step out of legal completely, stepped into healthcare.
I did. I actually did it in a stepping stone where I went in to be in the general counsel's office of a healthcare company.
Okay.
It was a progressive enough organization where they didn't sort of define you by your education or department you're in, was able to move up in that organization and move over to an operational position, which was
cool.
Was interesting for me.
Yeah,
Yeah.
that's pretty awesome.
So what type of healthcare organization was it? Like, was it focused in dental, or was it focused on devices, medical devices, or what? Like, give us a little background there.
Yeah, so it was in the medical device space.
Okay.
So imagine a company that's around the operating theater, spine, orthopedic, neuro, surgical instruments, had a direct impact on patients' lives, what we did. So that sort of gave you the purpose.
Purpose.
Yeah, you didn't have to look very far.
Yeah, and being able to see that impact has got to be huge.
Absolutely.
Now, purpose related was that, I mean, clearly these implants, these implantables and devices impact the lives, but was there like an issue with accessibility, or how did you kind of take that purpose and make it flourish, so to speak, if that makes sense?
So imagine in the space we're in, and I'll give a great example. So we were in hydrocephalus shunt. So imagine pediatric patients that actually, for their sustainable life, need shunt technology. And we get stories back from our patients talking about how they had a small child that got our shunt technology and they were able to actually go back to school again and leave a productive life. And so, I mean, that's the kind of stuff that you can do in healthcare that you couldn't do as a corporate securities attorney.
That's a really
That's
cool
cool.
story.
Yeah, we did some really cool things. That's why I guess we'll talk about it, but that's why I
my
think there's
heart.
a purpose in healthcare.
Yeah. Yeah. That is, I think, one of the things that I get to do here at MB2 is talk with a bunch of dentists, and almost holistically, they enjoy the patient side. And it's, hey, we are impacting people's lives. And I've heard Dr. V say it plenty of times. He's like, hey, we are stalwarts in the community. We're impacting patients' lives. And that's really what the purpose and purpose of the profession is, and is fulfilling, which is awesome. Awesome.
That's really well said. The cornerstone of our vision, mission, values is improving the quality of a patient's life. And we feel like if we never lose sight of that, we'll be a successful organization. And so that's the cornerstone. We talk a lot about the fact that it's a privilege to be in healthcare.
Yeah.
It comes with a tremendous amount of responsibility. We need to own that responsibility.
How did you make the jump into dental?
So for me, I was in the med device space for a period of time. A private equity firm contacted me and asked me whether I would make a transition and run a dental lab space. I started to look into the space. I find it fascinating.
And super fragmented.
Super fragmented. And so decided to make the transition there because I feel like the dental space is in its stage of transition, right? A fragmented market, a lot of technology and innovation, structural changes with things like MB2's doing, and thought what a fascinating space to be in and hopefully influence positively.
So you felt like the timing was right. You had done and fulfilled a purpose and were maybe just ready for something different and saw the opportunity.
Absolutely. And took advantage of the opportunity, and I've never looked back. I think it's a great space to be in.
That's awesome.
So when did DDS Lab come about? Like when was that? I mean, clearly the idea you capitalized on, or you said, "Hey, I've got this idea. I want to move over into this space." But then where did your current organization that you lead? When did that become?
What's your superhero origin story?
Superhero origin
If DDS
story.
Lab is the superhero.
Oh, right. So the backstory on DDS Lab, I like that, is they literally spun out from a DSO. And I think that's really interesting because we're a market leader in the DSO space because that's our DNA. We understood what requires to support a DSO, what the value proposition is. That was back in the 2005, 2006 period of time. It grew over a period of time, continuing to focus on that segment of the customer base.
Interesting.
That segment grew significantly. You can see it with your organization right now, and we continue to grow with our customers.
That's awesome. That's awesome. So when did the relationship with MB2 start, or when did you get connected with MB2?
MB2 predated me, so that was probably 6 or 7 years ago when we started to partner with MB2 in the marketplace.
Okay, that's awesome. That's awesome. Yeah, it's, we talk about fragmentation. When I speak with doctors, we always ask about suppliers and, who do you guys use? And there's some big boys there, right? And there are big boys in the lab space, but I hear constantly, I have this local lab. I use this local lab. I use this local lab, local. And so when Sarah and I were doing our prep and we were talking about fragmentation, I'm like, this is exactly mirrors what I do because I hear it. Like, I get it. Like, there are so many unique providers out there, yet you've got these great opportunities to get quality, I'll say instruments or quality elements for patients on a wider scale, which you guys have been able to accomplish and provide, which is awesome.
Yeah, and as you pointed out, the market's fragmented both on the dental office side and on the lab side. But, but look what MB2 does. By you guys creating a DSO, the technology and innovation you could provide to offices that standard offices have challenged to do on their own, improves patients' lives, right? Access to technology and innovation, doing the same thing on the dental lab side. It's more difficult for small local labs to continue to invest in technology in the future. Larger labs have that ability, have the scale to support companies like MB2.
Well, and I like that your story was kind of like a soft launch into dental. You didn't jump from corporate securities attorneying to being in the dental space. You kind of stepped into medical device and then into lab. So what do you feel like, it's not a huge jump from industry to industry, medical to dental, but what do you feel like you learned being involved in a $400 million device company into DDS Lab?
So this won't sound profound, but I think two things for me in that space. So when I was in a med device company, we had 4 divisions. Our product portfolio was everything from surgical instruments, as I indicated, to shunts, orthopedic, spine. And what you recognize as a company is you can only do a few things well, right?
Right.
So pick those critical few objectives, align your organization, and execute. Otherwise, you'll get distracted. And the second thing is you grow. Organizations have a tendency to focus internally. That's the biggest mistake you can make. You've got to focus on the customer backwards. So those are probably the 2 foundational items I brought to DDS Lab. We align around some critical few objectives, starting from our customer backwards, and I think that defines our success.
I think that's profound as hell.
Mm-hmm. I love the mission and your comment that you said about that we're focusing on one thing, and if we keep that at the center of everything we do, we can't not be successful. Dr. B says the same thing. He's got the focus both with the partners externally to the patients, and then certainly us within this building, and then the other support team, where it's like, hey, if we're here supporting our partners and we're focused on doing and providing the best quality care from the patient backwards, we're going to be successful. And I think over time, certainly we've been able to prove that out on the patient side. So there's just a ton of similarities, it sounds like, between the organizations, which is really, really cool and makes sense that now we've connected and have worked together for many years now.
I do believe that a strategic partnership starts with having common culture, right? Mm-hmm. If you have the common culture, you work through the other issues. If not, you find that you can actually meet the needs of your customer base. And the culture that was established at MB2, the whole market sees it, right? It's a unique culture that allows you guys to really thrive. And it's hard to replicate. I think others try.
What are you guys doing to build and maintain the culture at DDS Lab?
Yeah, so for us, our team came together almost at the most 2 years ago. I think we all started together as a team. And so the first thing we did was launch our vision, mission, values, right? As an organization, everybody does it. And we started focus. We said we're going to focus on improving a patient's lives. We came up with our values around integrity, accountability, transparency, always acting with our customer in mind. And we said if we do those 2 things well, we'll be a global player in the dental lab space. But it's one thing. Everybody puts that on the wall. It's living it. So it starts with our senior leadership team. We have to exhibit that every day. We have to be transparent with our customers and our employees. And, we do that by having effective communication meetings on a regular basis. Yeah. We have an operation in Shenzhen. Every month we have a meeting with their team, talk about what their needs are. We have an operation in Costa Rica, the same thing, and in Tampa. So we're one organization, even though we're spread across the globe.
Well, and starting off with a very clear intention for the organization, have you seen a situation in which a fraction has maybe, drifted and you've had to kind of course correct and be like, oh, because I feel like you guys are huge. And I feel like being able to identify your core values and missions, it's a lot to keep in line and it's a lot to keep your eyes on.
Yeah.
Really well said. And I think what you can't do, this sounds you can't blink, right? When you see somebody not living your values, they should probably work in an organization that aligns with their values because your values are what's going to dictate your success. So I think it's being very deliberate.
Yeah. And it's, it's finding the right people with the right values, and maybe they're not in the right position. And there's always going to be an opportunity within the organization because they align.
They just need a different seat on the bus.
That's a great way of saying it.
Shout out Dr. Conwick. She taught me that.
That's awesome. That's awesome. One of the things that, again, as we were talking, I think came up in conversation was you're not so focused, talk about culture, right, and building that culture. You're not so focused on titles or who sitting in the room, is the senior person, like our senior executive engineer of sound, Pepper over here. You're not focused on those are the guys that need to make the decisions. Those are the guys that have to have the ideas. How has that played out at the organization?
So we think that's really important, that title and position shouldn't dictate your voice in an organization.
That's huge.
And so if because we have tremendous talent at all levels. And so what we really push on as an organization, if we have an important decision, we ask ourselves, who should we get around the table? Mm-hmm. That's important to us. And again, it's not title or position that dictates it. And then we make sure that we actively listen to them first. And we talk about as a leader, the great thing is, you're going to get to talk, right? Just be an active listener first. Let the other individuals talk. And usually by the time you get to the end of it, you recognize they had a better idea than you did.
Do you have like, I would like to hear how this played out in real life. Like JT and I were talking a little bit about this, and ego's easy to get distracted by. And so being able to sit around a table with people that you're like, okay, I know what we should be doing here, but I'm going to sit and listen to somebody like our producer who's maybe more skilled in producing than me, but being like, I have a solution to this, but okay, wait, yeah, you were actually right in this situation. Do you have like an example that's played out that you could share with us?
That's really interesting. So I should be able to say that quickly to you because I'll tell you where, for me, it works a lot more easily. Because I come from medical device, I recognize I'm still actively learning every day as compared to projecting as to what we should do. But I would take it as something as simple as this. We were coming up with a distribution structure for the U.S. marketplace to get our products on a timely basis to our customers. I knew how it would work in the med device space, right? And thought, boy, we'll just take that and replicate it. And we had our distributor supervisors say, boy, that, I hear your idea, not a really good one. Came up with a better
Good
way.
try.
Yeah, but here, if we did this and you hear it and you listen to it and go, boy, let's actively listen and let them lead the project. So I think that's a great example for us.
That's
yeah, that
cool.
is a good one.
That's really, really cool. What do you think? We have spent a lot of time on the podcast talking about technology and the advancements in technology and how those have incorporated not only in practices, MB2. How do you foresee technology moving forward, aiding and assisting what you guys are doing?
So I'd probably give one that's sort of short term and then, of course, the longer term one. The short term one for us that I think is really interesting is the move to digital dentures. So you see in digital dentistry, crown and bridges move there. But on the removable side, it's really a traditional workflow. And now the technology's caught up where you can do 3D printed dentures, better patient outcomes, better workflow. And I think that's going to be exciting short to midterm. Long term, and I know everybody talks about it, is artificial intelligence. We see what's happening at the dental office, right? Using the dental AI platform as a treatment plan. And then on our side, imagine using AI ultimately to design product, right? So, yeah, the long run, you can see an integrated dental office with a dental lab. You get this integrated workflow that goes back, better quality, faster turnaround time, better outcomes. I think that's where we'll be. It might be 5-10 years from now, but that's where the market's going to move.
Keep moving that way.
Have to.
Here I was thinking he was going to say quantum computing, but
I can't even spell that.
no,
I can't even pronounce that. Is there anything you guys are working on right now that you're really excited about? Technology, I think, is one of those things that it's happening really quickly. And so you're talking about, a few years in the future. It could be less than a year in the future. What are you guys doing now that's exciting?
I think in addition to our 3D printed denture, which I say short term, I think midterm for us, it's the use of artificial intelligence for the designing of restorative products. And if we can do that at a high level, get better outcomes, I think that's going to move our organization forward on an expedited basis.
This may be a kind of a crazy question to ask. Are you guys working to develop that in-house? I mean, I know AI is something I don't understand, and I don't understand how it works.
It's kind of like the cloud to me.
Yeah, it is.
Like people talk about it, and it's just like a thing that exists.
It's just up there.
It's just like it's
there.
it's AI next to the cloud.
It's like, hey, are the Excel files in this room with us? Is the cloud here? Or,
yeah.
but,
Am I the cloud?
So
Yes.
are you guys developing that in-house, trying to, or are you working with partners externally?
With partners externally.
Okay.
Just like we talk about having the most knowledgeable person as an employee, you need to leverage your partnerships.
Yep.
There are people brighter than us that wake up every day working in that space. Let's use them to advance our organization.
Yeah, that's great.
Yeah,
That's
I
great.
like it.
So you mentioned this in the pre-show notes. I've never said that before, but that sounds pretty cool.
Does
Pre-show notes that I want to go back to your corporate securities time. You worked with Ken Starr?
I did. Did I send that to you?
You did.
Okay.
You
No,
did.
you were supposed to say no. We found it in our research because we're
sorry.
smart researchers.
Well, I
people.
did. I researched the pre-show notes.
Yeah, got fair.
Any good Ken Starr stories? Clearly, of Ken Starr, for those, I mean,
I was about to
maybe
say-
we've got some young folks, but he was the chancellor and president of Baylor University most recently. I think he's passed away now, but he worked on the Bill Clinton impeachment or Monica
Don't say there's
Lewinsky.
young listeners. I didn't know who that was.
Well, yeah, but you're young.
I'm old. Yes, so Ken Starr was Bill Clinton's.
Arch nemesis?
Yeah, he was kind of like an investigator
Yeah.
in the Bill Clinton Monica Lewinsky
Scandal.
Scandal.
affair.
You're like,
Right.
let's just call it what it is.
But you knew him well before then, right?
Yeah, so I knew him after that.
Oh, you did? Okay.
So my story with him is I had moved over to the B. Braun organization. Now I'm in healthcare. I started off being the general counsel in that organization, and we had an appellate matter that we had to go to court with, and we retained Ken Starr to assist us in that.
Oh, that's
and
cool.
So at the time I was, I'd say, still early in my career. And what defined me there, and it's something I learned from, is I had tremendous respect for him because he was an appellate court judge. As you know, he was a special investigator.
Thank you.
And as I spent the time with him, at the end of that, he gave me a lot of feedback and gave me confidence that I could be a general counsel and do the work that was required for our company. And you start to recognize that people that you respect, when they take time to give you feedback, how important is that to you? So that was my anchor for me in the feedback that he gave to me as I went on and we partnered. Now, we did lose the case, so I don't know what that's
You're like, just to be clear.
Clear.
Well, I like it. I like the point you make about getting feedback from people you respect. Do you have other mentors that you've had help
a
you
great
along the
question.
way across your magnitude of functions and roles and industries?
I really did. I say all along the way, there's been individuals that have taken an interest in me, which I truly appreciated, which helped me to advance. Even to this day, people that I reach out to, their confidants, and say, hey, help me through this issue. I don't think you can develop if you don't have those type of resources. And I think it's responsible as you become a more senior leader to take that responsibility to develop others as well.
How do you do that?
I think one is you need to actually give of yourself, right? You have to identify people that have potential, spend time with them, and commit to developing them. And sometimes their development isn't necessarily in the best interest of the organization, but it's in their best interest. And that could be anything from having them go work somewhere else at some point in time, even though they're talented for your organization, or moving them into a department that will grow them, but short term might not be in the best interest of your organization. I think that's the kind of commitment you need to make.
That's huge. And
That
I can
is.
see how it wouldn't be something that comes easily to a lot of people.
Well, it's just counter to how I would say the masses think today, which is what is the decision that needs to be made today that is most profitable or successful today because we have to deliver immediate results versus we're going to work on these folks and mentor these folks like a tree. You water a tree, it's not going to just sprout up tomorrow. And
Are
if
you
it does,
supposed to water a tree, or does it just rain?
well, I mean, yeah, but 6 one way, half dozen, right?
Yeah, 6 one way, half a dozen. Yep. Continue.
So that is again, going back to what you've said about keeping the mission and keeping the focus. I think you clearly have applied that not just in business and leading a business, but also leading people, which is incredibly admirable. We've got team members here that I wonder, and I know Sarah is probably the reason the question came up, like she wonders too. It's like, how can we best develop the folks that we get to interact with? So it's great to hear that it's, hey, slow and steady wins the race.
I mean, if you're building a long-term sustainable organization, that's what you need. And if you have the right people, most problems you can solve.
Do you have a piece of advice or life, I don't know, perspective that you want to share with us that you took away from one of your mentors? This is where I feel like I get the best nuggets on this podcast.
Yeah, no doubt.
I think for me, it's regardless of the situation that your company is, never lose your core values, because you can have pressure because of something that occur in the marketplace, something with the results, but you can't lose your North Star. And I think making sure that, and this sounds really trite, if you can't say it in front of a room, you don't do it. And I think if you can anchor on that, do I feel comfortable taking this position and telling a large group? If I do, go. If I don't, then don't do it.
I knew it. I knew that I wanted to ask that question. Don't say, if you're not going to say it in front of a large room, don't say it. I need that one.
Oh, that's funny. Well, Chuck, so the listeners can get to know you personally a little bit better. I know you said you're a Steelers fan. What do you do outside of leading DDS Lab? Like, what do you enjoy?
So I have a family. I'm married. I actually met my wife first day of law school. Isn't that interesting?
Oh, that was cute.
It was
And you just like sat next to her and were like, hey, cutie.
we actually on a
Want to
train
go
together.
steady? A train?
We were taking the train to Villanova University. I met her on the first day, never looked back. I have 3 children, all living in the Northeast. And so Family's my cornerstone of what
Love
I
it.
do. I enjoy jogging, but I'm poor at it. I actually got into hot yoga, which that's an embarrassing
Okay.
thing to say. Yeah,
No, it's
really
amazing.
hard, not good at it, but I tried it.
There's something about I'm not a yoga person. I don't like that I have to sit here and hold this position. I'm ready. Let's keep going. There's something about hot yoga that feels like I'm so focused on just trying to survive it that feels like I'm not rushing into the next thing. That's what I
Well
think the
said.
benefit
I,
is. Thank you.
I kind of like that. It's like, hey, get to the next pose, get to the next pose, you hear about the incredible benefits of yoga. I'm like you, Sarah. Though. I get there and I'm like, okay, this sounds cool, and I know it's good for me, but I'm
There's something about just sweating
Yep.
it all out that I'm like, yeah, that was productive.
yeah.
Yeah.
How old are your kids?
I have a 30-year-old, a 27, and a 24-year-old.
What are they up to?
My oldest is in advertising. My middle one, I'll say followed my footsteps. She's a commercial litigator, although
wow.
she's as disappointed as the profession as I am. And my youngest is an accountant, and he's in Boston.
So do you still do whatever you're supposed to do to keep up your like attorney title?
Like
No.
CLE,
No, I stopped.
I don't know what that means.
continuing legal education.
Yeah, the CLEs, if you will.
No, I stopped. So if I gave any legal advice right now, it would be malpractice.
Is this where we have to put the disclaimer? All opinions shared here are of our own and not legal advice.
right.
Well, before we wrap up, where do you see the future of the partnership between DDS Lab and MB2? To your point, we've been really solid partners for years. What do you think comes next?
So for me, and I'd say overall, it's continued to move from what I'd say could be a transactional relationships between dental labs and DSOs to a strategic partnership. And when we're executing at a high level, we understand what your strategies are, and then we align our organization around our customer strategy. I think that's the next step for us. We have actually a meeting right after this, our quarterly business review, where we sit down and talk about where we're going as an organization, more importantly, understand where MB2's going, and then say, how do we line up around that? I think that's what's going to be really important for us.
It's cool to hear that because that goes back to your core mission is like starting with the customer and working backwards.
Yes.
Yeah, that's
I learned
awesome.
something.
Well, Chuck, we're going to let you off the hot seat now. We have
Thank you for your chucking time.
Oh, I hope you can come up with at least one more before we close out. But we really appreciate you coming on and spending some time. I know you are a busy man with the organization, DDS Lab, and I'm excited to have gotten to know you a little bit better and look forward to seeing you around here.
Thank you
Chuck.
very much.
So, MB2 Undergrounders, that concludes another episode of the MB2 Underground. We will see. I'm trying to work at a Chuck pun in.
I got it. Just
can't-
finish.
Okay. We will see you guys next time.
Chuck, yeah.
You're too good.